Hello, Jess here, pelvic physical therapist with Mindful Motion Physical Therapy, and we're going to talk a little bit about pain in the postpartum period that can be related to scar tissue if you've had an episiotomy or a perineal tear that's required some stitching. So there can be lots of reasons why you might be experiencing pain in the postpartum period. Some of those reasons are if you have scar tissue that's a little tight and restricted, that can feel a little uncomfortable. You can have pelvic muscles that are actually contracting a little too tightly, and that narrows the vaginal space and makes any penetration difficult and or not possible. We could have a prolapsed organ pressing into the space of the vagina that can be a little bit uncomfortable. You could be experiencing decrease in your natural lubrication, and that's related to postpartum hormones, especially if you're breastfeeding. And so there can be lots of reasons why you might be experiencing pain with intercourse, and it's pretty important that you understand where that's coming from so that you can better treat it. Today, we're going to talk just about if you think it's coming from scar tissue. So obviously you need to get clearance from your OBGYN, your midwife, or your pelvic physical therapist before starting any scar tissue massage. We can start gently around 6 to 8 weeks and be more aggressive as that scar continues to heal. It's never too late to start massaging a scar, however, the earlier the better. You can really use anything to massage the scar. So if you're in the shower, you could just be using water. You could use a little bit of vitamin E oil or a lubricant, a high quality lubricant that you may already have, and even just a little smidge of coconut oil. Of course, the shower is convenient and pretty easy, but you can also do this at night before going to sleep or first thing in the morning, or really whenever you can squeeze this into your life. So I'm going to demonstrate this on my hand. So this right here would be the entrance to the vagina, the bottom part of the vagina. So this right here would be the skin between the entrance of the vagina, and then this would be the anus right here. So scar tissue, perineal tearing can happen in different grades. So there's 1, 2, 3, 4, and 5. So grade 1 is just a little bit of a tear. Grade 2 kind of comes towards that perineal body. Grade 3 goes right to the start of the sphincter, and a grade 4 would go through that external anal sphincter. So regardless of the grade, you're going to want to initiate some scar massage as a way to improve the tissue resiliency, like how well it can move and open and expand and contract. You're going to want to bring blood flow and circulation to help that area heal, and also as a way to sort of desensitize the nerve endings that are there as well. So if we imagine that this is a clock, so straight up would be noon, here at the anus would be 6 o'clock. You would insert a thumb vaginally, and I say a thumb because that angle's easier than trying to do this. And just a little bit of an insertion. It doesn't have to go deep. And you'll apply pressure straight down to 6 o'clock. Now we want that to not be painful. You might feel a little bit of a sting or a burn, but it should be really mild, like a 2 on the scale, 10 being like unimaginable pain, 10 being childbirth, okay? We want this to be like a 2. So you're gonna hold that 2 o'clock pressure, 6 o'clock pressure, and scoop through, and I'm just going to use my fingers so you can actually see, and you're going to scoop through the bottom of the clock. So I'm going like 8 o'clock, 7 o'clock, 6 o'clock, 5, 4. Okay, and that's just a way to really see what's tight, where is that scar, what's restricted. Okay, that feels a little snug right there. So you might just hold that pressure. Okay, and give it a little stretch, 30 seconds. You might kind of roll, so you're keeping that pressure on the scar and kind of roll in and out and side to side, and maybe some circles. Another technique that can be really helpful is if you take your finger, so your thumb would be inside the vagina, let's just say a little bit off to the left, and then your finger on the outside is going to be on that tissue, that muscle that's between the vaginal opening and the anus. And you're going to kind of pinch that. You want to have something there between your fingers. And then you just kind of roll. Okay, maybe do some circles, push it side to side. Okay, there's really no wrong way to do this. Wrong would be if you're not doing it at all, or if it's painful, okay? So just get in there and gently start moving it around. This is safe to do for a couple of minutes. Several times per week would be just fine. And obviously, if you have really specific questions based on the timing and the intensity and the specific needs for you as a unique person, make sure you consult with somebody like a pelvic physical therapist who can help guide you on this. And the last thing I'll say as we finish this today is just positioning. So if you're doing this in bed, you might want to prop yourself up and just have your knees bent and wide, or a couple pillows under your knees would be fine, and then you'd come in at this angle and do exactly what we just talked about. And if you wanted to try this in the shower, it's a great way to just kind of put a leg up on like the ledge of the bathtub or a shelf somewhere in the shower and do the work like this. So that's a little bit about perineal scar tissue massage, and I'm sure there'll be questions about that. Just let me know down in the comments below, and I'll see if I can help you out if I can.